Americans are turning to telemedicine in record numbers with everything going on. So joining us today is Dr. Charles Van Dyne from WellMed to share what you might need to know about telemedicine. Now, Dr. Charles, tell me, what can patients expect to see?
Well, pretty much what we're seeing right now. You're going to have a big picture of the other person and a smaller picture of yourself on there. And this is exactly what our visits will be like. It may look slightly different whether you're doing it on a smartphone, a tablet, or a desktop computer, but keep in mind it's a face-to-face visit, all in the comfort and safety of your home. And it's on a secure platform, and which is really important to keep into account when you're talking about private health information. But it looks just like this.
Yes, definitely things you want to take into account. Now, what about those who aren't so internet or technologically savvy and not sure how they feel about telehealth? What are some tips you have?
So chances are, if they aren't, they'll have a friend who is, and I happen to be, but my go-to is my grandson, because the kids always have the best phone and know all the tricks and turns. But if they should get familiar and practice just with the technology or the device before they actually try to use it in a visit. And you can do a FaceTime or Skype or even Zoom meeting with somebody else to understand kind of that dynamic and how you work your phone. And it's just, all you have to do is allow the camera and microphone, basically. So for one of our visits, we have an app that they put on their device. And so you go into the app, but you need a username and a password. The reason for that is, and because it's very tempting to just send them a hot link, right?
Yes.
But the reason for that is to protect their privacy. We want to make sure it's just them and nobody gets in there. So that's how they go in. They go into a virtual waiting room. The provider's notified to join the visit, which they would do because they know exactly when to go in there, that the patient's ready. They go through the visit just like you would in the office, talking to the patient, inspecting whatever they need to. They can send medications to pharmacies just like you would if they were in the office. They can order labs and x-rays at another facility if that's appropriate, and then go over your plan. And also, if you need a work excuse, all of that without you having to get off your couch.
Wonderful. I think this is useful information and certainly something we can carry into the future regardless of the circumstances. Now, I'm sure there are some situations that are appropriate, maybe not as appropriate to do a telehealth visit. What are some of the services and symptoms that we want to look out for someone considering?
So, first of all, let's start with the obvious. Don't do it. And that would be severe chest pain if you have a heart problem, for instance, or a wound or injury that's got a lot of blood loss. But it's for the kinds of what we call acute non-urgent care. So we're talking cold, cough, sore throat, minor GI issues, some skin conditions are obviously amenable to it. But don't forget, since over 50% of our patients are delaying care because of COVID, they need chronic care follow-up. So you can do chronic care follow-up. For instance, so if you have high blood pressure, you can show the blood pressure readings to your doctor. And quite honestly, those are going to be probably more accurate than in the doctor's office, because we all know how much we like to go to the doctor's office and get our blood pressure taken. And the same thing with our diabetic patients, showing their blood sugars to the doctor and that kinds of things, and other chronic conditions. It's also very important for behavioral and mental health access. Because, initially, sometimes people don't feel comfortable going somewhere to have that done, but now they can have that in the comfort of their home. And believe me, we're going to need it with COVID going on because of all the stress, both physically and emotionally, that's happening around COVID. So those are the kinds of very common cases for it.
Wonderful. Well, this is all useful information for anyone watching at home. As you heard from Dr. Charles, no reason to be discouraged. Just find someone who has the knowledge about technology. Once you get past that hurdle, I think the rest of it is pretty easy, and you're saving time and a lot of energy.
Well, it is. I mean, we've had almost 100,000 visits and the 90% satisfaction. So that does say something, that if that many people can do it, it cannot be as difficult as some might think it is at first.
Exactly. Sometimes it's just getting past that first experience.
It's very much getting past that first one. And then they come back and say, oh my, I want to do this all the time.
For everything.
We're going to have to reel them back because some things aren't appropriate for telemedicine. So that's been the overwhelming response is, oh, I didn't think it was that easy.
Sure. You're saving gas money and everything in between.
That's
so
right.
If anyone wants more information, where can we go?
So wellmedhealthcare.com is our website, myhealth/myhealth team. If you're not a WellMed patient, you're welcome to look at our website, of course, but you should check with your provider, because many of the providers in the community have adopted telehealth in some form. because of COVID continue to take care of their patients. Because at the end of the day, our goal is always great patient care and a great patient experience.
Beautiful. Well, thank you, Dr. Charles Van Dyne, for sharing your time with us today and your expertise. For anyone wanting more information, head over to that website and get filled in on how you can practice telehealth.
Thank you very much, Carissa.